So, what are veneers? What are dental veneers? And this is a very common question, and there's actually more than one answer. So, in this video, I'm going to go into a little bit of detail about what exactly are veneers, who's a candidate, how do they work, and how do the appointments work, and all of that fun stuff. So, let's do this. First thing to know is a porcelain veneer. It can be many things, and it could be many thicknesses, and it could be, in different materials. So the actual basics of it is it's a thin layer that's covering the front of your, so it's usually on front teeth. We can go all the way to the back, but people usually know it, by the things that people do to their front teeth. So veneers are almost like when you see veneered wood, it's very similar to that concept. It's a very thin layer of porcelain that gets placed, and it covers the front of the teeth and a little bit of the bottom. People are a little bit more familiar with crowns or caps, and it's slightly different. Usually with crowns it's because we're missing structure, a tooth got fractured or things like that. With veneers, it's usually done to enhance the smile, to make, if we want a big color change, if we want a big volume change, texture, anatomy, contours, and things like that. So I want you to think about it as if you're thinking about almost like a contact lens porcelain that gets placed on your tooth. Now, let's say you have really dark teeth and you want to really brighten up the smile, then we start playing with the thickness of the porcelain. And at least in my hands, I don't want your veneers to look unnatural or artificial or anything like that. So of course this was all designed from the beginning. The contours and the shapes, everything gets designed with your face, and with, for it to go in harmony with your face. I've already covered some of that in some of my other videos. If you're curious about how a smile design is, you can go to some of my other videos. But this one is about, once we've designed the smile, how do we actually place that in your teeth? So, like I said, think about almost like contact lens porcelain that gets placed on your teeth. A lot of people have heard about the no prep veneers, where the teeth don't get touched and then the porcelain gets placed on top. Truthfully, that's, it sounds better than what it actually is. Very few people are candidates for no prep veneers and for the results to still look natural. Imagine that teeth really, when you're looking at teeth and you're looking at natural teeth, it's almost like they're coming out from the gum, right? But imagine if you had to just put a layer on top of it. It's almost going to look like it's coming out of it, and that's when veneers start looking a little bit unnatural. Also, another big thing is if we're trying to change the color, if you have really dark teeth and we're trying to change a few shades, then the thickness of that porcelain needs to get a little bit thicker. So imagine if, the teeth are not touched, and then you have to put thick porcelain on top of those teeth. So a lot of times these no prep veneers look very unnatural. And like I said, there are some very specific, very limited cases where it can look incredibly natural, and it's the way to go. But for the most part, if you want natural results that belong to your face, that look like natural teeth coming out of, your gums, then the no prep veneer route might not be the best option. But like I said, there are some candidates that are really good for it, especially if you have really thin teeth and you're trying to get some of that volume. After that no prep category of veneers, then we have the very minimal prep veneer. Now we're talking. Because with minimal prep veneer, it's a very conservative way to still enhance and, add all of those really fun contours and volume to your teeth, change shade, but we're really not removing much of your tooth structure, and we're just strategically placing a very thin margin. We're talking 0.3 to 0.5 of 1 millimeter, so it's very, very thin. We're still on enamel, which is the outside structure of your teeth, so we're still, very conservative, but it really gives you that oomph to your smile. So that's minimal prep veneer, where it's very strategic, where we remove a little bit of the tooth structure, and then we're able to really enhance everything else. If you need a huge shade change, then, minimal prep veneers is really not the answer, because once again, we need a little bit of thickness to cover the darkness of the teeth. And if we don't prepare enough, then it's gonna show through. Sometimes people have a tooth where they got hit or they have trauma as a kid, and then that tooth became really, really dark. Sometimes in those cases, a root canal was done, and sometimes we can do a little bit of bleaching inside of the tooth to really brighten it up, and then we don't really have to prepare much of the tooth. But sometimes that tooth is just really stubborn and it just won't change colors. Then the rest of the teeth can be minimally prepped, and then that one tooth gets a little bit more thickness of the porcelain. So it's all customized and made for you. Not, every single veneer is exactly the same. So even in the same person, the same smile, we had to play with the tooth structure that we have. If you have big fillings or you chip the big chip in that tooth, then we also have to play with the thicknesses, because truthfully, at the end of the day, and I'll tell my patients all the time, you're trusting me with your smile, and I really appreciate that, and it's the best compliment that you can give me. But with you trusting me with your smile, you're giving me a little bit of artistic freedom, and I'm assuming you trust that I'll do what it takes to give you those results that I promised. It's really important for me to be able to deliver on my promise. So it's really interesting to understand that in terms of veneers, there's different thicknesses, there's different materials, different kinds of porcelain that we use depending on the situation. If we need to mask something, if we don't need to mask anything and we just need thin, really thin to structure to just increase volume and not really change that much of the shade. If we have a patient that grinds a lot and then we need to discuss the materials that are a little bit stronger or more similar to enamel. If it's a patient that's more the cosmetics part, then there's different materials that enhance a little bit of that. So it really comes down to the knowledge of your provider, the person that's doing your veneers, and it really comes down to what your goals are. So make sure that you have a very specific discussion with your dentist. You get to test drive with me, you get to test drive your smile, you get to test drive what your veneers will look like, and it's a very accurate description of what your final result will be. So it's really important that that communication happens, that if there's little tweaks here and there, that happens as well. So let's say you're ready for veneers with your smile design, you approve of the design, and it's the day that you come to get your veneers done. Appointment 1. You come, if it's minimal prep or almost no prep, for the most part, you won't need any numbing. If there's some areas that need a little bit more of a preparation, then you'll get some numbing. Truthfully, at the end of the day, the most important thing always is for you to be incredibly comfortable while I'm working on you. Not only because I cannot work on somebody that's not comfortable, but also because, the experience there shouldn't be any discomfort related to this experience. So not only that, but I actually can't physically work on somebody that's uncomfortable. It's just something I've never been able to do. So even if you need a little bit of numbing, it's quite simple to get a little bit of numbing. I get complimented a lot on getting numb, so on how I numb, so it's really no big deal. But like I said, if it's minimally, it might be in just some specific areas, or you might not need it at all. On that day, we do the preparation, we confirm that's what you like, and we place your provisional. So you'll walk out of the office with that smile design in temporary form. The cool thing about that is that you're like walking around test driving that design in function in real life, because you'll be having it for a few weeks. About 2 weeks after you come back, back to the first appointment. We prepared everything. We took a digital scan. We prepared your gums to take that perfect digital scan so that it's very accurate to exactly where your veneers go. And we send it to our technician. I work with really skilled, internationally known technicians that, it's really important, because when you're doing a smile design and when you're doing veneers, this is totally optional thing, unless it's once again because due to an accident or something like that. So I want to make sure that because this is such a cosmetic thing, you have to be absolutely enamored and totally in love with the idea of what it looks like. So I need, my job is only part of the job. Then I really rely on a very highly skilled lab technician to really deliver that beautiful result in porcelain, which is what I planned from the beginning. So that first appointment, like I said, you walk out with your temporaries. The temporaries are they're gonna look very similar to what your veneers are gonna look like. Of course, different material because I need to be able to remove it. You just have to be really mindful and very careful while you have your temporaries, because of course I can't completely glue them in your teeth, so you just have to be careful not to bite anything too hard. But other than that, you can have a pretty normal lifestyle for the next 2 weeks, and then you come back to me. On that appointment, I remove that temporary and I try in your porcelain individually. I put some try-in cement and I try it all in, I clean it all up. We take pictures, we go outside, we look at different lights, you look at every single different angle, we take a video. I wanna make sure that you absolutely love this. Usually, we call it a try-in because I want to make sure that everything is perfect. If there's one little thing that's not absolutely perfect, your veneers are not going in, because I want to make sure, once again, that what I deliver is not only something that you love and that is something that I love, but it's something that functionally fits perfectly on your teeth. Now, once we're all done with that, you love your veneers, we cement them in, we clean everything off. It's a very, very very detail-oriented, very technical part of what we do. We go tooth by tooth. We just want to make sure that we condition and the environment is perfect for that awesome bonding of that porcelain, so that it almost becomes part of your tooth. Now, once that's all done, we floss everything, we check your bite, we make sure that everything is feeling really good. And once that part is done, what we do is we go ahead and let you go home. I let you enjoy your bite. It's really awesome because your gums start really loving this new porcelain and coming down, and just like, basically making sure that now the veneers and the teeth look really natural coming from the gums. And once that happens, it's like that's almost a cherry on the top. So I always tell my patients, the day I've delivered the veneers, everybody's super excited and super happy, but it looks really good now, but next week is gonna look amazing. And I always give you instructions, even during the temporary period, on how to maintain and keep your gums nice and clean, because as a temporary, it's very difficult to floss. So there's other things that I want you to do so that your gums are in tip-top shape, so that when we deliver those veneers, everything works really, really awesome. So usually you go home, you go home with your veneers. I usually like to see you one more time just to confirm that everything feels good, that your bite feels really good, that there's nothing that, that I need to adjust. Sometimes we make small adjustments and that's it. And then you go and you enjoy your life with your beautiful new smile. So I really, really hope that this answered a lot of the questions that people usually ask me. I focused this video on porcelain veneers. There's also composite veneers. That's gonna be a little bit of a different video, but just to give you like a quick comparison, porcelain veneer and composite veneer, just two different materials. Ceramics, there's different kinds of ceramics, but in terms of composite, that's different than porcelain. And there's a big debate, right, on what's better and what's more conservative or what looks better. And, there's like two different schools of thoughts, and I'm actually very open-minded, and really it comes down to what your goals are, what it is that you want. I'll explain the pros and the cons, what the differences are, and then you decide what material you like. So usually dental veneers are more expensive than composite veneers. And usually if it's like a budget limitation, it's, having composite veneers is a great transitional solution. It gives you that smile that you want, and we can buy some time until you're able to do the real full-on porcelain, which is of course nothing really can compare completely to that beautiful smile with the porcelain veneers. But we do really gorgeous work as well with composite, and there's many options as well in that. So I just wanted to make sure that you understand that there's a difference in material. There are benefits to one and there's benefits to the other, and it really comes down to that communication, that discussion, doing the test drive, looking at the before and after, looking at some of my cases that are with porcelain, some of my cases that are with composite, and then you take it wherever you want to go, because you are the co-author of your smiles. So hopefully this answered a lot of these questions that you may have, and if not, then just send me a message and I would love to hear from you, and hopefully it's something that we can, answer for you. So anyways, thank you so much for watching this video. Bye.